They're tiny, painful, and way more common than you think. Canker sores affect nearly 20% of the population, and that number skyrockets in people with stress, poor diet, or hidden health issues. These aren't just random mouth ulcers. They could be warning signs of vitamin deficiencies, autoimmune disease, or even undiagnosed gut problems. And here's the kicker. Most people just wait for them to go away, missing the chance to fix what's really causing them. In this video, we're breaking down exactly what canker sores are, the hidden causes behind them, the early symptoms you need to watch for, and the treatments that actually work to stop the pain and prevent the next outbreak. Whether you get them once in a while or all the time, knowing what's going on inside your mouth might just be the clue your body's been trying to send for years. Before we dive in, let me know in the comments, how often do you get canker sores? Now, without any further ado, let's get started. What are canker sores? Canker sores, also known as aphthous ulcers, are small, shallow lesions that form on the soft tissues inside your mouth. You'll usually find them on the inside of your lips, cheeks, under the tongue, or at the base of the gums. Unlike cold sores, they don't appear on the outside of the mouth and aren't caused by the herpes virus. That's an important distinction. Cold sores are contagious. Canker sores are not. What makes canker sores particularly frustrating is how painful they can be for such a small wound. Most are only a few millimeters in size, but because of their location, where food, drinks, and toothbrushes constantly rub, they feel 10 times worse. And they don't just hurt. They burn, they sting, and they can linger for up to 2 weeks. Causes of canker sores. The exact cause of canker sores is still a mystery, but doctors and researchers agree that multiple triggers are involved. One of the biggest is stress. Psychological stress, especially chronic anxiety, has been repeatedly linked to canker sore flare-ups. One study published in the Journal of Oral Pathology and Medicine found that students were far more likely to develop canker sores during exam season than any other time. Another major cause is trauma. Accidentally biting the inside of your cheek, brushing too hard, or even dental work can trigger an ulcer. But the story goes deeper. Many people who get recurring canker sores are actually dealing with nutritional deficiencies. Low levels of vitamin B12, iron, zinc, or folic acid have all been strongly associated with mouth ulcers. Then there's the immune system connection. Some researchers believe canker sores are an autoimmune response, where the body mistakenly attacks the lining of the mouth. That would explain why people with immune-related conditions like celiac disease, Crohn's disease, and ulcerative colitis often experience frequent or severe outbreaks. Food sensitivities also play a role. Spicy foods, citrus, chocolate, and even toothpaste that contains sodium lauryl sulfate can trigger canker sores in sensitive individuals. And finally, there's a genetic component. If your parents got canker sores, chances are you will too. Signs and symptoms. Most canker sores start with a burning or tingling sensation in one spot inside the mouth. Within 24 hours, a small, round, or oval sore appears. It's usually white or yellowish in the center with a bright red border. The pain tends to peak within the first 3 to 5 days, especially when eating, talking, or brushing. Mild cases involve just 1 or 2 sores at a time. But in more severe cases, people can develop multiple ulcers all at once. These can coalesce into larger, irregular-shaped wounds, making daily activities incredibly uncomfortable. Some people also experience swollen lymph nodes, fever, or general fatigue during outbreaks. These symptoms suggest a more systemic issue and should never be ignored. If your canker sores are coming with additional symptoms, it could be a sign that something more serious is going on internally. The key is to pay attention to the pattern. Occasional sores may just be from irritation or stress, but frequent, long-lasting, or unusually large sores point to something deeper. But before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of canker sores. For most people, canker sores are diagnosed visually. If you go to a dentist or a doctor, they'll usually examine the sore's appearance, size, and location to rule out other conditions. But when sores keep coming back or show up with other symptoms, additional tests might be needed. Blood tests can check for vitamin deficiencies, immune system abnormalities, or signs of celiac or Crohn's disease. Sometimes, doctors may order a biopsy if the sore doesn't heal after several weeks, just to rule out oral cancer or other rare conditions. It's important to distinguish canker sores from other mouth lesions. Cold sores, oral thrush, leukoplakia, and even certain STDs can look similar at first glance. That's why persistent or unusual sores should always be evaluated professionally. The earlier you get to the root cause, the sooner you can break the cycle of pain and recurrence. Treatment of canker sores. The good news is that most canker sores heal on their own within 7 to 14 days. But that doesn't mean you have to suffer through it. Several treatments can help reduce pain, speed up healing, and prevent future outbreaks. Over-the-counter numbing gels like benzocaine provide fast relief by dulling the nerves around the sore. Mouth rinses with antiseptic or steroid ingredients can reduce inflammation and prevent infection. For more stubborn cases, doctors might prescribe corticosteroid pastes or even systemic medications in severe autoimmune-related outbreaks. If a deficiency is the culprit, supplements for B12, iron, or folic acid can make a huge difference. In one study published in the Journal of the American Board of Family Medicine, patients who received monthly B12 injections saw a dramatic reduction in both the frequency and severity of their sores. Avoiding known triggers also helps. Switching to a toothpaste without sodium lauryl sulfate, cutting back on acidic foods, and managing stress with techniques like deep breathing or exercise can reduce flare-ups. For people with chronic, painful sores, doctors may recommend immunomodulating treatments or investigate for underlying glycemic index or autoimmune diseases. The key takeaway? You don't have to just wait it out. There are real, proven options that can give you back your quality of life. Complications of untreated canker sores. Most people assume canker sores are harmless, and for the most part they are. But in certain cases, ignoring them, or what's causing them, can have bigger consequences. Repeated trauma from eating or brushing over a sore can lead to secondary bacterial infections, turning a simple ulcer into a more serious wound. In people with weakened immune systems, these sores can last much longer and become more prone to infection and deeper tissue damage. Chronic sores can also indicate undiagnosed immune or gastrointestinal issues. If those conditions go untreated, they can lead to long-term complications affecting digestion, absorption of nutrients, and even increased cancer risk in some cases. It's also worth noting the emotional toll. Constant mouth pain affects eating, speaking, socializing, and mental health. The frustration of not knowing when the next sore will hit can lead to anxiety and isolation. That's why it's so important not to dismiss canker sores as just a sore. Your mouth is one of the fastest healing parts of your body. If it's not healing, something's not right. Preventing canker sores. While you can't always stop canker sores from forming, you can lower your risk by identifying your triggers and making simple lifestyle adjustments. Start with oral hygiene. Use a soft bristle toothbrush and avoid toothpaste with harsh ingredients. Maintain a healthy, balanced diet rich in B vitamins, zinc, and iron. Keep a food journal if you suspect certain foods are triggering your outbreaks. Stress management also goes a long way. Even 5 minutes a day of deep breathing, journaling, or light exercise can lower your body's inflammatory response and reduce your chances of flare-ups. And don't ignore the pattern. If you're getting sores more than a few times a year, or if they're getting bigger, more painful, or lasting longer, talk to your doctor. Early intervention is everything. Canker sores might seem small, but they can carry a big message, whether it's a vitamin deficiency, a reaction to stress, or a sign of something deeper going on in your body. These tiny ulcers are often your body's way of waving a red flag. Understanding the causes, recognizing the symptoms, getting a proper diagnosis, and using the right treatments can turn a painful, recurring problem into something manageable or even preventable. Now it's your turn. Have you ever dealt with frequent or painful canker sores? Drop your experience in the comments. We want to hear how you've dealt with them. And if this video helped you better understand what's really going on inside your mouth, don't forget to subscribe. We've got more straight-talking, science-backed health videos coming your way every day. Thanks for watching.